The coronavirus crisis is likely to have an unprecedented impact on British economy and society. However, it's very important that we use all the weapons and tools at our disposal to mitigate the impact of this. This short presentation shows some examples of digital technologies and how they can be used to mitigate the effects of COVID-19. My name is David Wortley. I'm a Vice President of the International Society of Digital Medicine and also run a company called 360 and 360 Immersive Experiences. What I'd like to do with you today is to share a little presentation identifying 10 different technologies which can play a part in mitigating the impact of coronavirus. So I'm going to load up the presentation and I'm going to start sharing it and show you some of the technologies that I want to discuss. So there are 10 technologies in this presentation and I'm using one of them at the moment. It's a virtual meeting technology called Zoom, and it can be used for virtual meetings, webinars and conferences. So the ability to share information and knowledge remotely without having human contact is a way not only of avoiding physical contact and transmission of COVID-19, but also it's a way of being able to react and share knowledge much more quickly than by face-to-face contact. The second area I want to touch on is telemedicine and virtual consultations. And each of these potential uses of technology will be explained in a little bit more detail as I come to them. Mobile applications are beginning to be much more prevalent in society and much more prevalent for use with digital medicine. And when you combine that with artificial intelligence, you get some powerful solutions. Wearable technologies, such as the kind of devices that I wear myself for my own personal health management, can be very useful for remote monitoring that helps doctors to be able to monitor their critically ill or chronic patients more effectively. Rehabilitation is often something which needs to be done in a specialist centre at the moment, but technology is available to allow this to be done remotely under the supervision of a trained practitioner. I'm going to talk about virtual reality and how this can be used for training and even for what we might call digital medicine. Big data analytics and genomics can help to personalize medicine in a much more effective way. And we shouldn't forget the tools of social media and virtual communities. And already there are some virtual communities on Facebook which are connected with coronavirus. I'm going to show an example of the use of live streaming and 360-degree videos for surgical training. And I'm going to finish off with immersive environments and virtual hospitals. So looking at virtual meetings, webinars and conferences, you can see from this video that I have personalized the background to my video to make it look more professional. It gives me the opportunity also to have sliding text banners which can communicate medical messages. So you can imagine that a doctor doing a virtual consultation can have his own customized NHS background with important notices scrolling across the screen at the beginning. Telemedicine and virtual consultations. There are quite a number of applications available. Probably the one that is most well known is an application called Babylon, which allows doctors to have a virtual appointment with a GP almost on demand. Mobile applications like Babylon increasingly will have embedded artificial intelligence, which allows practitioners to do some triage. And in this particular example, it's an application called eConsult, which can help to reduce the amount of time that patients spend in A&E waiting to be triaged. Wearable technologies, such as the one that's on my wrist, can be used as a way of providing continuous care to patients with chronic conditions and patients with conditions like coronavirus, that allows a practitioner to be able to monitor these patients much more effectively without the need for physical consultation. And it relies on the clinically validated medical data that's provided by the devices that continuously monitors and provides alerts when necessary. Rehabilitation is something that is normally done within a specialist unit, but there are now tools like Rehability, which uses consumer games technologies like the Microsoft Kinect to provide rehabilitation exercises which can be monitored, and these can be rehabilitation exercises for both physical and cognitive conditions. Virtual reality is becoming increasingly important, and the screenshot that you see here is from a product developed by a company in the UK called Immersive, and it's designed to train radiologists in the use of an MRI scanner. And you'll see from the icons on the screen there that there are three virtual people within this training environment. And they're actually able to simulate the use of an MRI scanner. All their actions are recorded, and they can be provided with support by a trained person. Now, the value of this is not only does it allow people to be trained remotely, but it also avoids the use of expensive medical equipment that really needs to be used practically rather than for training purposes. This is an example of the use of virtual reality for conditions like stress management. And here we can see a young girl wearing a virtual reality headset. And she is in a simulated virtual environment. And these kind of environments can be used in conjunction with clinically validated exercises to not only assess a patient's condition, but also to provide things like stress relief by placing them in a relaxing environment. Genomics and the use of big data analytics is increasingly important because it allows us to be able to personalize medicine much more effectively and not prescribe patients with unnecessarily with drugs and antibiotics if we have a better understanding of individual patients' genomics. Social media and virtual communities are a great influence on people's behavior. And this is a screenshot from Facebook virtual community on the coronavirus situation. Live streaming 360-degree video is a very powerful tool, but it is now even being used to have collaborative surgery, where surgeons in different locations can collaborate on a complex operation. And in this picture, you see the celebrated virtual surgeon Shafi Ahmed with his VR headset on, performing an operation. And his operations have been viewed in 360 degrees by thousands of people live. Finally, immersive environments in virtual hospitals. There are many different applications, but the use of 360-degree photographs and images, like the one that you see on the screen there, combined with 360-degree video, can create immersive virtual tour environments that not only allow people to navigate through hospitals, but also can be a great educational tool for both patients and staff alike. So that is the conclusion of this short presentation. I hope it's been valuable as an insight into just a few of the technologies which can be used in a practical way to mitigate the effects of coronavirus. My name's David Wortley. I am very happy to provide support, advice, consultancy, and practical services like the creation of virtual backgrounds like the one you see here, training people in the use of these technologies, and the design and development of virtual medical tours. Thank you.